Well, the numbers, they're just staggering. Experts say 330,000 women will be diagnosed with breast cancer this year, and 40,000 will die of cancer. There are doctors and researchers on the front lines of medicine, though, working every day to change those digits and using technology and advanced medicine to do it. Like Dr. Gary Thomas, he's the medical director of the oncology department for St. Joseph's Candler. He's been working in the field for 33 years and tells me that improvements to treatments are changing the game for the better.
Surgery is probably one of the biggest changes I've seen, whereas in the beginning, women would have to have the entire breast removed. And now clinical trials have shown just a lumpectomy is really what a lot of them need. So they can preserve the breast in many cases. Radiation treatments are much more effective than they used to be. They're more targeted and more precise and less side effects as a result of that. So what you used to have to give 6 weeks of radiation in many cases, some patients need 3 or 4 treatments. One of the areas in terms of chemotherapy improvement is giving less of it. So we probably give 70% less chemotherapy now than we used to. And that's a result of the advancements that we've made with the genetic and genomic testing of the tumor itself. So we can give a score to a patient and say, based on your score, you need chemo or you don't need it. Everything that I just said about reducing the surgery, the radiation, the chemo, all that came as a result of clinical trials. So drug development is all clinical trial. It's made it actually more interesting and harder, more challenging, because you've got to make sure, I've got to do everything I can to make sure I individualize this patient's treatment, because you don't want to just give them garden variety treatment. We have access to all of the clinical trials throughout the United States. There's a database that we all use. So if there's a trial open in California or New York or Texas, many times we'll have access to that trial right here in Savannah in the Low Country. Immunotherapy, people confuse it with chemotherapy. They're infusions like chemotherapy, but they're revving up your own body's immune system to attack the cancer cells. We've only had chemotherapy up until now for that, but now, again, clinical trials, you combine immunotherapy with chemo, you can shrink the tumors down at the beginning rather than doing surgery. This is another area where it's evolved a lot. You almost never saw a patient that you would not do surgery first. So there are patients that now we give chemotherapy and immunotherapy ahead of the surgery, trying to shrink the tumor down to allow for a better cosmetic result and a good oncologic result. Every year, more 3D mammograms, we have supplementary ultrasound, MRI, and I know nobody wants to hear this, the use of artificial intelligence is going to make the accuracy of the readings of the mammograms tremendous, and that's happening right now, so that's going to be prime time. So I think the number of mammograms that are missing cancers, let's say, or what the human eye might miss, that's going to be decreasing significantly.
Now, Dr. Thomas says while the goal is eradicating the disease, other medical advancements like CDK are also allowing many people to live longer with a better quality of life, almost making their cancers a chronic disease rather than deadly. But while medicine is getting better, he says the best way to stop it is prevention, and that's through getting mammograms. Well, taking a live look right now at our